Thank you for joining us today. We're hoping today's conversation is not just thought-provoking for you, but also gives you the momentum needed to get past the addiction to the status quo that has plagued the healthcare benefits industry for years together. This status quo has led to some extremely stark numbers. So let me rattle some of these off for you, right? According to healthcare economists, 25% of all healthcare spend in our country is waste. So think about that for a second. $1 trillion of $4 trillion of spend, waste. And that manifests itself in every single plan sponsor's pocketbook. 60% of US adults have a chronic disease. 40% of US adults have comorbidities, with over 22% of adults between the ages of 40 and 69 on 5 or more prescription drugs. 40% of the US counties, which is over 41 million Americans, don't have a pharmacy within 15 minutes of their home location. They're being called pharmacy deserts. Mind-boggling numbers, right? And all of these changes have been fundamentally driven by a volume-based healthcare system that has continued to reward service providers for more services, more drugs, more diagnostic tests, more, at the expense of the employer, the union fund, and more importantly, the patient. We're sitting out here as the richest country on the planet with an abysmal mortality rate and with healthcare costs rising. So now fast forward to where we are. We're hopefully coming out of a pandemic now that has laid bare a public health system that has a ton of challenges and opportunities for improvement. We have employees, union members, and our communities at large struggling with fundamental issues like access to care and health inequities. All of this is compounded by a mental health crisis that at this point in time feels more like a tsunami than just a crisis. If we don't fundamentally change the way we think about our expectations of our healthcare benefits right now, then when? We really can't wait any longer. Isn't this the time to make big changes, even if they're small ones and headed in the right direction? You know, experts will tell you that great change requires two things: an inflection point and disenfranchised stakeholders. We have both of those in place right now. An inflection point like no other, right? What could be more of an inflection point than the most significant healthcare challenge of our lifetimes? And disenfranchised stakeholders, employers, plan sponsors. You're picking up 80% of the healthcare, commercial healthcare tab in the country and continue to get jerked around. If we wait for others to demand change, we're going to be waiting for a really long time. Seize the moment and demand change now. We can't wait any longer. So with all of that being said, we have an amazing lineup today to talk to us about all of these things and much more. Welcome to the Value Exchange. I am super excited about this next speaker. Netflix was the speaker's baby and brainchild. Anyone who's read his book knows that the phrase "that will never work" was uttered by his most ardent supporter and believer, his wife, right? What makes change so hard? And why is it absolutely imperative when consumers are going through major inflection points? When Netflix was born, we didn't even realize we needed it. All we knew was what we were tired of, right? Retail video cassettes with movies that were never available, dirty stores, and late fees. Familiar? Blockbuster, right? All of that, Blockbuster pops up in your head. Netflix completely changed the way we saw an industry that seemed stuck in its ways. Beyond his innovative work at Netflix, his career as an entrepreneur spans across more than 4 decades. He's been a founder of more than half a dozen other successful startups, a mentor to scores of early stage entrepreneurs, and an investor in numerous successful tech ventures. As mentioned, he is the author of the internationally best-selling memoir, That Will Never Work: The Birth of Netflix and the Amazing Life of an Idea. Host of the Top 10 show, or the Top 10 podcast actually, That Will Never Work, and a star of Entrepreneur Magazine's Elevator Pitch web series. As someone who exemplifies industry innovation and is a true thought leader on transformational change, please welcome Mark Randolph.
Well, thank you so much. It is great to be with you all. In fact, I wish I could be with you in person. But since I can't, I thought I might start off with a little bit of a travelogue. Or more specifically, I'm going to share with you one of my favorite places. And it's not a beach, it's not a beautiful mountain, it's actually in a city. And more specifically, it's a building. And I'd like to show it to you right now. It is this building, which is the Renaissance Tower in Dallas, Texas. And looking at this building, you may be saying, how could this be one of Mark Randolph's favorite places? Well, there's a simple reason. It's because this building for many years was the headquarters of the Blockbuster Corporation. And more importantly, a meeting took place here in the year 2000 that profoundly changed the shape of my life as an entrepreneur, as well as changing the trajectory of this little company I was running at the time called Netflix. Now, back in the year 2000, Netflix was a very, very different company than the one you might know now. I mean, we were young. We were about 2.5 years old. And we were small. We had perhaps 100 employees. And that year we were on track to do about $5 million in sales. Now, unfortunately, we were also on track to have accumulated losses of nearly $50 million. And you do not need to be a Silicon Valley person to understand that is not what they mean by a repeatable, scalable business model. So, being $50 million in the hole, we decided to do what entrepreneurs do when faced with that situation. We decided to pursue strategic alternatives. Now, you may recognize that that's code for we have got to sell this sucker and fast. Now, the obvious strategic alternative was Blockbuster. But in the year 2000, Blockbuster was in a very, very different place than we were. We had 100 employees. They had 60,000 employees. They had 9,000 stores. And we were on track to do $5 million in sales. They were on track to do $6 billion. So we were nothing to them. So when we called them to try and get a meeting, we emailed, we used go-betweens, nothing. Until they eventually called, and as luck would have it, they called us when we were on a corporate retreat in Santa Barbara at a dude ranch up in the mountains. And I remember talking to my co-founder, Reed Hastings, and saying, they want us in Dallas, Texas tomorrow. How are we going to do that? And we did the obvious thing you would do when you're $50 million in the hole. We chartered a corporate jet, and we flew to Dallas, took a cab, and went up to about the 27th, 28th floor of the Renaissance Tower, and they ushered us into this conference room that seemed to me the size of a football field. Giant conference table made out of some kind of endangered hardwood, and I'm standing there since I'd been on retreat in a t-shirt and shorts. And I remember I was a little jealous because Reed, he had on a Hawaiian shirt. I mean, he had buttons. And then in come the Blockbuster folks, and they're, of course, in their very expensive suits and fancy shoes. But we sit down and we make our pitch that we should combine forces, that they will run the stores, we'll run the online business, we'll find those mythical synergies everyone's always talking about, and everybody wins. And the meeting was going great. I mean, they were asking good questions, they were leaning in, but then they asked the big question. How much? I mean, if we were to combine, how much are we talking about here? And we, of course, had rehearsed this in the plane. And since we were $50 million in the hole, we figured nice and neat. So Reed leaned forward confidently and said, $50 million. And you know what they did? they laughed at us. Well, maybe not out loud, but that restrained shaking, trying to hold in the laughter at the hubris that this little company in the depths of the dot-com meltdown could possibly be worth $50 million. And the meeting went downhill pretty quickly after that, and it was a long, quiet ride from Dallas back to Santa Barbara. But I remember being so disappointed because I thought Blockbuster was going to save us, but now they weren't not only going to save us, they were going to compete with us. And I knew that there was no easy solution, that if we were going to get out of this, we had to do it on our own. It was like my father used to tell me, sometimes, Mark, the only way out is through. But this gave us the resolve that we would do anything it took to get out of this hole and eventually prevail. And it took us quite a while, but eventually Blockbuster went into bankruptcy, and eventually Netflix became the company it is today. And it's kind of interesting, isn't it, that the company that used to be the king of the universe is now down to a single store. Now, this story in some ways is an inspiring one about how just a handful of people with no experience in the video industry could take down a $6 billion category leading company. But it's a somewhat different story, isn't it, if you're the $6 billion category leading company? Because then it says you have no idea who's coming after you, that they're going to look nothing like you. And they're going to come after you, not doing the things you do well, but doing the things you do poorly, or don't do, or can't do, or are scared to do. You see, the lesson, whether you're big or small, is that if you're unwilling to disrupt yourself, you're leaving it wide open for someone else to disrupt your business for you. And one more thing. If you wake up with that great idea and you come rushing downstairs and you tell your spouse, or you come into the office and you excitedly tell the board, or you tell your team, or you tell your coworkers, and they all say, that will never work, well, you're always welcome to call me because, as you know, I like every idea that I hear.
Hi, Mark. Thanks so much for joining us at Value Exchange.
Oh, it's great to be back with you.
So, when we took a step back, Mark, and we thought about who we needed here today, for a topic that was about the future is now, only one person came to mind: you. As someone who has built a career, or more accurately, a legacy on going against status quo, you truly embody innovation. As we invite our audience to stop thinking about things the same old way, especially as it pertains to healthcare benefits, your story showcases how having the conviction to embrace doing things differently can really create meaningful and transformational change. So, if you're ready, I have a couple of questions for you that might be very pertinent or very interesting to our audience. So, first off, let's discuss the consumer climate when you started Netflix. As history has told us, right, important change requires an inflection point. And when you began, the at home entertainment industry was dominated by one, Blockbuster, with a substandard customer experience. So when you think about that and you think back to then, how did that status quo enable your success? Or how did going against that status quo enable your success?
Well, it is interesting because at the time, video was in a very, very different place. There was essentially a monopoly. There was Blockbuster, and they were the huge company in the space. They had 9,000 stores. Um, and I think that had made them a little complacent. And in many ways, at the time, the video rental experience was fairly frustrating. I mean, there were surly clerks and there was stock outs, and it was very, very hard to find a movie you wanted. And not to mention, of course, there was due dates and late fees. And People hated those things, but they had no alternative. And I think when Reed Hastings, my co-founder, and I were casting about for what would be an interesting business to go for, when we saw a large, established, $6 billion business where customers were plainly frustrated, we said, "This is for us. This is an opportunity to come up with an entirely new way, a new experience in video rental." And at the same time, there was a number of technological things going on that we felt we could possibly take advantage of. I mean, the internet was still reasonably new, and people were just beginning to experiment with what could you do with this technology. They were starting to sell things over the internet, and that was an interesting observation. And then perhaps the other big breakthrough that happened at the time was the industry came out with a new format for movies called the DVD, this little thin plastic disc, which at the time was nascent. You know, less than 500,000 households across the entire country had a DVD player. But for some crazy reason, we thought maybe if we combine these two things, we can totally turn this upside down and take advantage of customers' frustration and take advantage of the fact that things had been done the same way for a long time and recognize that, the time is now. We can shake things up a little bit.
I love that. You know, when I hear you, Mark, what strikes me is there's an entire generation that doesn't know what a DVD is and doesn't recognize the word blockbuster. And Netflix now is a verb. Let's Netflix it is almost an alternative for streaming it, right? I love it. I absolutely love it. So the audience hopefully is listening to you and realizing there are so many parallels between your, David and Goliath story and what we see in the market today. So you had an entire industry that was doing it this way, yet you had the courage to say, well, there's a better way, right? The results speak for themselves. They're revolutionary. But as we learned from you today, right, transformational change doesn't have to be big. It doesn't have to be complex. It doesn't have to be scary. Yet people feel that way. Why is that? I mean, what about transformational change didn't scare you?
Well, there's a fundamental human emotion, which is we don't want to make fools of ourselves. We don't want to make mistakes. We don't want to do something we're not quite sure it's going to work. And that's an entirely natural human feeling. And certainly, I'm no different. I don't want to do things. I've I will tell you, I am the master at speaking many, many languages terribly. Um, I've tried to learn so I can stumble along in a bunch of different languages. So I've gone through this. And the reason I'm so poor at it is that learning a language, as a lot of people know, requires that you speak it. You can't just watch tapes. You can't just read books. You can't study 3 by 5 vocabulary cards. You've got to screw up your courage, walk into the coffee shop and order a coffee and open your mouth, and you're a full grown man, and out comes words that sounds like you're 6 years old. And that is a terrifying thing. And taking on new things is no different. And so none of us want to do that. We're terrified to try something that may not work because we think the world might collapse. But as you exactly point out, and I know you've said many times, it does not need to be scary. And one of the ways you make it scary is you don't take these huge swings all at once. You take a small bite and, okay, it didn't work. And you look around and hey, the world didn't collapse. I didn't get fired. My customers still like me. Maybe I can try something else a bit new. And Netflix was no different than that. I mean, we were, you know, you mentioned doing things that people don't think are going to work. Well, no one thought this was going to work. The book is called That Will Never Work because that's what everybody told me. As you heard, my wife said that.
Yeah.
And they were right. Didn't work, but that was fine. We knew it wouldn't work. Again, we were willing to take chances and try things because we knew eventually we'd figure it out. It just required that courage that there's a better way. We can transform the status quo, um, and we have we have history on our side. It
Right.
sounds trite, but we knew that this would not stand. It was being propped up by something else. And if we kept nibbling away, taking small bites, trying different things, little by little, you get closer and closer. And then all of a sudden you go, whoa, oh my gosh, that little thing I never thought would work ended up being the one that transforms a business.
I love it. Mark, I work in an industry where, like you were going up against Blockbuster. I'm in an industry where 80% of the traffic is controlled by three Fortune 10 companies, right? So talk about folks telling us day in and day out that will never work. Thankfully, it isn't my wife, but you had your most ardent supporter telling you that it wouldn't work. And so let's talk obstacles for a second here, right? Forces that impede innovation. There's always going to be those that essentially said it wouldn't work. So how did you overcome that? How did you overcome the naysayers, the disbelievers, and really forge forward?
It's actually a really interesting question. Uh, it requires two seemingly different emotions, skill sets, and it's interesting because it's what I when I work with entrepreneurs or invest with other entrepreneurs, I'm looking for something very specific, because when you're doing something that everyone says that will never work, it requires a fairly big dose of self confidence. I mean, the most important ingredient you can have is self confidence, which is you have to think, I know everyone's saying this will never work, but I don't believe them. There, there is a way to do this. I don't know what it is yet. I can't see it, but I feel it. It's enough of a feeling that I'm going to keep trying. But you have to couple that deep self confidence with this openness to learn, to ask people's opinion, to rely on domain expertise. Not You don't need to do what they say, but when you say to someone, "Tell me why you think this will never work," and they go through their reasoning, I want to listen very, very carefully to make sure I understand those objections. I'm not going to necessarily accept them because, again, I'm self confident. But Adam Grant, who's a social psychologist,
Oh
he
my
said,
God, I was just thinking Adam Grant and his book, The Originals. Go ahead, keep going, please.
no, no, because you probably know the famous quote I'm going to do too. And he always says that the key thing is basically to argue like you're right, but listen like you're wrong. And I
My
thought
God, I
that's
was
exactly,
literally thinking Adam Grant as you were talking right now. I love it. Mark, keep going. Sorry.
despite me saying, oh, you can fight down your fear and take these steps, some stuff is still really scary. And it sometimes helps to have a few alligators that make you we willing to jump over that. A mixed analogy here, but you get the idea.
I get the
And
point.
yes,
Yeah.
on the plane home, when Blockbuster had turned us down, it was this terrifying moment. This terrifying moment that they weren't going to save us; they were going to compete with us. And then you load onto that the fact that we were hemorrhaging money. At the depths of the .com crash, no visible way of raising more money. Everything was conspiring against us. But it does force you to look inward and say, okay, enough complaining. What are we going to do about it? And everything's on the table, as painful as it may be. What do we have to do? What do we have to throw overboard? Um, what steps are we going to have to take? And it was really, really a good discipline for the company. Forced us to say we need to have a business model which is actually makes more money than it costs to deliver, which at the time, just like people don't remember Blockbuster or DVD, they don't remember this we'll make it up in volume era, where
Oh
you
my
could
God.
sell things for less than they cost you, and somehow that would come out okay in the end. I don't think so.
You just talked
Um,
about what healthcare in this country is all about.
Volume.
Yeah,
Go ahead.
it's right. It's an unsustainable model that somehow no one has the courage to want to change.
Is it just courage or is it something more?
Oh, you couldn't have said it better. I think a lot of it is courage, but courage sometimes means the courage to do the thing you know is right, even though you recognize there'll be some pain involved. And I'm not saying that change isn't sometimes painful. I'm not saying that sometimes change isn't scary. I'm saying that you can tell when change is necessary, and having the courage to do something that's painful and scary is what being a leader is all about. And in these cases, when you say, well, this is a 1% chance, yes, maybe this is a 1% chance that I've landed on the right solution. But I know with a much, much greater than 1% certainty, with a 95% certainty, that the existing path is going away. And my decision is, do I do something about it now? Or do I let myself be the boiled frog? We at one point we were 99% of our revenue came from selling DVDs, and it didn't take a genius to look into the future and say it's a commodities business. It's going to be sold on price. Those big players like the Amazons and the Walmarts are going to drive the margins to zero, and we can't compete in that business. And is it going to happen tomorrow? No. Is it going to happen next year? No. Is it going to happen in 2 or 3 years? Probably. So I should do something about it now. Is that easy? No, because it's paying 99% of my salaries. But I'm willing to walk away. But and listen, here's one more piece to this. The fundamental truth is that doing both things at the same time usually means you don't do either of them very well. So the temptation is, well, don't stop selling. Just keep on building the rental business and use the selling to keep paying your salaries. And you realize you're confusing customers. Well, do you guys rent or do you sell? You make everything harder. Your website's confusing. Your checkout process is complicated. Your inventory management, you're arguing about the metrics. That if you really want to get it right, you got to pick one thing and focus on it. And you just got to pick clearly, you pick the thing which is the future. And in our case, we walk away. It happened, but it happened again. Once we did streaming, all the same problems. Well, and now you have a streaming business and a DVD business. Well, they're confusing. And just think of how hard the checkout process is, and
Yeah.
think about the inventory management and the metrics. And so you go, I don't care that DVD delivery is 99% of the business. The future is clearly streaming. Let's put everything we have into that and not make compromises. And Netflix has done that over and over and over again. And again, I'm not saying it's not scary. I'm not saying it's hard. I'm not saying you need to go all in that way, but you have to recognize that the customers fundamentally don't care about your past. They don't even care about your present. Your customers care about your future. And if you're not willing to do the things that the future dictates, I guarantee that some other company will do what your customers want in the future.
The parallels you drew for us in this is, especially as you were talking about walking away from, or not the Amazon piece as well as the Walmart piece, and moving away from DVD sales, was you chose value over volume. You realize
Yes.
that people playing the volume game were going to get commoditized. There is no way you can make a dash to the bottom line and play purely on unit costs and deliver anything meaningful. It's not possible. It's not going to be meaningful. The experience is not going to be lasting either, right?
And fundamentally, if you're going to go after the status quo, you can't do what the status quo already does very, very well. You have to go
Exactly right.
after the status quo doing something that they aren't doing, or uh, aren't willing to do, or can't do. And a lot of times, they're, it works both ways. Sometimes you're the one locked in, and it requires tremendous courage to walk away from your existing business. But sometimes you want to put yourself in a position where you're going to force the other guy to do that. And most of the time they don't. You look at the Fortune 50 from 30 years ago, blow your mind how few companies
Yeah.
are still on it, because they get locked into these existing business models, and they're not stupid. You know, they see what the future is doing, what future customers want. That, as in, healthcare systems, these things are unsustainable, undeliverable. But the cost of changing is so hard and so painful. It's easier to say, well, we'll nibble at the edges and we'll deal with it in 3 years when someone else is CEO, and that's music to our ears.
That's exactly right. So, Mark, what's so inspiring about you is that even beyond Netflix, you continue to see the change, you continue to be the change. I mean, you obviously did extremely well coming out of that Netflix IPO. All right, in your book, you literally write, "I never had to work. I did not need to work another day in my life." Right, and yet you've continued to push for transformation. You started companies, you help entrepreneurs succeed. You are making a difference in this world. What motivates you? What makes you continue to push for change and behave differently?
It, yeah, despite, and I appreciate the glowing words. I'm I'm selfishly motivated too, but maybe in a different way, which is I kind of learned a long time ago that if you're lucky, you learn two important things about yourself. And you learn one, what am I good at? What do I do well? And then you learn a second thing, which is what do I enjoy? And probably one of the luckiest breaks in my life is that I learned both those things early. And perhaps even more importantly, I learned they were both the same thing. And it was early stage companies. And so, yes, Netflix was great for me, but it got to a point where it was no longer a startup. It had the resources, it could hire amazing people, and it needed different talent than I had. And more importantly, I didn't like it that much. And I realized that if I'm really going to be successful, successful doesn't mean, oh, I stay and let my stock keep vesting or I stay. No,
Yeah,
success means getting to do the things you're good at and that you love. And that's working on early stage companies. So I'm having the time of my life. I love the fact that I still get to work with early companies. I still get to do the things that we're doing today, which is talk about innovation and change and transformation. Um, this is what makes me whole, and makes me want to keep pushing.
that's an amazing level of self-awareness. You know, Mark, with that, you've left me for sure, but I'm sure our audience with this mindset of what would Mark do as they approach things, right? Uh, this has been an amazing conversation. Thank you so much for being here. And we really wish you all the best. You are, as I mentioned, as we kick this conversation off, you're an inspiration. I've read your book twice, and I feel each time I read it, I learn something more from it. Thank you so much for today.
It is certainly my pleasure. And listen, as a customer of the healthcare industry, I, with deepest sincerity, wish you all the luck we could use as a society, all the help we can get. And I know that you're fighting the good fight. So keep at
Thank
it.
you. Take care. Thank you. Population health management and health equity can seem like really heavy topics, even though they need to be at the forefront of every employer, union, and plan sponsor's thinking. So, when we took a step back and thought about the right thought leader for these topics, we immediately gravitated towards someone who we've repeatedly watched on TV take extremely complex healthcare topics and break them down into extremely digestible information that is both pertinent and actionable. I am beyond thrilled to host today's fireside discussion with a doctor with deep experience and expertise in population health management and health equity. She served as Baltimore's health commissioner, is a professor of health policy and management at George Washington University, and a senior fellow at the Brookings Institution. She has been named one of Governing's Public Officials of the Year, Modern Healthcare's Top 50 Physician Executives, and is on the list of Time Magazine's 100 Most Influential People. Please join me in welcoming Dr. Lena Wen. Hi, Dr. Wen.
Hi, Karthik. Nice to join you today, and thank you so much for the honor of speaking with you and your team.
Thank you. This is going to be, I'm really looking forward to this conversation. I think I've shared this with you before. I'm more than a closet fan. So, with that being said, let's jump right into it. So, Dr. Wen, we're hopefully coming out of a pandemic here where the strengths and weaknesses of our public health infrastructure have been exposed, right? We're the richest country on the planet with an abysmal mortality rate and with soaring healthcare costs. Employers and Taft-Hartley plans now pick up the tab on nearly 80% of commercial health insurance premiums in the country, and yet continue to grapple with rising costs and poor clinical outcomes. So that's really the starting point for our conversation today. So with that being said, my first question to you is, pharmacy benefits are now 30% of an employer's healthcare spend. So it's high time that PBMs start behaving like healthcare companies. Yet PBMs have continued to behave like retail companies with conversations around rebates and arbitrage. And employer purchasing behaviors haven't forced them to change how they behave either. What role do you think a PBM should play to be a more robust part of our public health infrastructure?
Well, first of all, I appreciated the opening and introduction you gave about the many challenges that we're facing in healthcare and in public health right now. You're right that we are evolving into a new phase in the pandemic. And the pandemic also has really unveiled, unmasked many of these underlying problems that we've all known about, but I think has really been unmasked because of COVID-19. It's also shown us how much, by definition, all the work that we do is public health. That health is not just about the health care that you receive, it's also about the housing that you have access to, the food that you eat, and of course, the pharmacies that you may have access to. The medication access is a major problem. That again, COVID, I think, really helped to highlight that not everyone has the same access to vaccines or to booster shots or to tests or to treatments. And so I think there's this other issue as well about chronic diseases, and we've also seen in COVID that that people with chronic underlying medical conditions are more likely to become severely ill due to coronavirus. People may not always utilize medications to optimize their health, and so I think PBMs can do a lot more, as we all can do a lot more to understand our role in improving the public's health.
Thank you, Dr. Wen. So with when we look at another construct, you introduced the whole last couple of years in the coronavirus into the equation, right? As we look at other topics that have really stood out in the last couple of years, health equity as has really stood out as something that is top of mind for most business leaders today. So when most business leaders today, though, look at health equity, they see it in very abstract terms, or they believe it to be something that's prevalent in communities that are challenged socioeconomically, right? But you and I both know that's not true. Health inequities exist in every single employer's population. So, our audience today that's listening to you includes employers, unions, and other health plan sponsors. So, can you talk to us in ways about the ways in which health inequities can show up in their membership?
Inequities are everywhere. And I want to give you an example of right here in my city, here in Baltimore. You look at two neighborhoods, they're just a few miles apart. And in one neighborhood, a child born today can expect to live 65 years. And in another, just a couple miles away, a child can expect to live 85 years. That 20-year gap in life expectancy is something that we see mirrored in communities all across the country. And it doesn't just have what to do with access to healthcare. It has to do with so many other factors that are intricately involved in what we call health equity. When I first started in my job in Baltimore, I used to show a map. And specifically, I would show the map of health outcomes by disease, whether it was drug overdoses or alcohol use or cardiovascular disease or infant mortality. And actually, over time, I stopped showing this map because it almost didn't matter what you had in the legend, as in the same areas that also had the highest rates of overdose. They also had the highest rates of cardiovascular death. They also had the greatest problems when it came to social economic divide and also had the highest rates of incarceration and so forth. And I say this because that map is the map of health inequity. And that kind of health inequity is mirrored no matter where we are in the country, no matter what company we are working with. These are definitely inequities that you would see in your population as well. And so the key is that we have to focus on it, turn our attention to it, and solve these inequities together.
One of the things that we've been very vocal about as EmpiRx Health, Dr. Wen, is the fact that you know the thought processes that flow through a person's mind when they think, and you were very articulate about it right now, but the thought processes that flow through a person's mind, even folks in healthcare sometimes, when they think about health equity, the first thing is, well, socioeconomic, then it goes to racial, then it says, well, there's maybe a financial component, and that's really more dominant. But one of the things we've continued to find is that just care inequities in themselves can can be very significant from health inequity standpoint, right? Because we look at there's enough evidence at this point to say that pain management for a black person is handled very differently than for a Caucasian, right? So if you could take the care angle to it, if you don't mind, why is health equity so critical right now? And how can we improve care and thereby clinical outcomes by more specifically and deliberately focusing on it?
Yeah, it's such a great point, Karthik. And I just wanted to piggyback on what you were saying, and also talk about what happens during labor and delivery. That when you look at something like maternal health, that yes, there are profound differences when it comes to racial outcomes. And then people might think, well, what about socioeconomics? How does that play into it? When you remove education, when you remove socioeconomics, you still find that there are huge disparities just by race. And that in itself is a major problem because it shouldn't be that we have these vast disparities. And so I think, to your point, the care inequities, what is happening in that clinical care setting that is leading to worse outcomes because maternal mortality, for example, is a never event. Women should not be dying in childbirth. And we really need to focus on what can we do in that clinical setting. Extrapolating out a bit, we can see that one of the things that I get concerned about sometimes when we talk about health equity or disparities is sometimes there is a misunderstanding. And that misunderstanding is that you have to level the playing field, meaning that you have to somehow take years of life from one group of people to add it to another. That is not what anybody is proposing. We're not saying that we all need to get to a lower baseline, but rather that we have to have all boats rise. That this is not about a zero sum game. That's not what health disparities are. And I think we have really seen the example during COVID 19 that when you improve health outcomes for those who are the most vulnerable, you're actually also improving health outcomes overall for everyone, that all of us are interconnected in this. That applies on a population health level, that applies on an individual clinical level. And I think we need to really embrace that health equity is a key theme for us going forward that improves care and that helps to reduce these rampant disparities. And if I may, I want to give you one more example of something that we were able to do in Baltimore that achieved both improved health as well as reduced disparities. We had a program that's still going on strong now, Be More for Healthy Babies. And it involves home visitation programs by nurse practitioners and social workers for pregnant women and postpartum families. Also involves providing free cribs and ensuring housing and working on these other social determinants of health. And yes, medication access and healthcare access as well. Our goal was to reduce infant mortality in our city, but it was also to reduce disparities. And we were able to do both, that within a 7-year period, as a result of this public private partnership across our city, we were able to reduce the infant mortality overall by 38%. But also, very critically, we were able to close the gap between Black and white infant mortality by more than 50% in that same time period. And so, this is not a zero sum game. We're able to do it both, improve health for everyone, while also focusing on the priorities for the most vulnerable.
Those numbers are staggering. Congratulations, Dr. Wen. The you threw a couple of words out there that are a perfect segue into my next question. Right, we're sitting out here. We think about the HMOs going away in the early '90s, and in my mind, that I look at all of what we've seen within health insurance over the next 32 years now. What we've consistently seen is the absence of a healthcare quarterback. As much as people wanted choice, they at least in those days had a PCP who could look at a whole person's health and understand what was going on. And what we've done in the last 30 years is we've continued to live through and buy these condition oriented programs that have been episodic at best and really haven't moved the needle. And exactly to the point you just brought up, right? This became painfully obvious as we've continued to, this has become painfully obvious, quite frankly, as we've continued to live through a pandemic where the most dominant condition hasn't painted an accurate patient risk profile, right? And so my question to you is really twofold. Why population health management and why now? And I think you touched on this briefly, but what are some of the strategies that you deployed at Baltimore that really took away from the episodic to the population centric care model?
Yeah, what great questions. I would say, first of all, for why now is it really should have been done before. But just because it wasn't done before doesn't mean that we shouldn't do something about it now. I mean, this idea of population health management, it's better for the individual, it's better for our system overall. And ideally, it also helps to reduce cost while improving quality. I mean, why wouldn't we want that, right? Why wouldn't we want improved access, improved quality, well, at a lower cost for everyone? That's ultimately what we're trying to get to. We're not talking about rationing care. We're talking about enabling the conditions that allow people to live their best lives when it comes to both physical health and mental health and improving their emotional well being. And so, why now is that it's an individual imperative because everybody wants to live better lives. And also, it's something that's important overall for the population because otherwise, as you were saying in your opening, I mean, where we are now in healthcare is unsustainable. We have a serious issue with access. We have serious issues with cost. Now, when it comes to the strategies that work well, I'm going to give you several examples, and these are not necessarily the ones that you would employ in your company, but I wanted to show that there's a lot that we each can do from the vantage point that we have. And so I'm going to give you three ideas. One is to start somewhere. So often, when the issues we face are really broad, sometimes there is this sense of decision paralysis of where do I even begin, right? If by definition, in public health and population health, if one thing is influenced by everything, how do you decide where to start? Well, my suggestion here is to start somewhere. It doesn't even matter where, just do something that's in your control. For example, we had a study in Baltimore that found that up to 10,000 of our children needed glasses, but we're not getting them. And so we said, let's get glasses to kids. Let's get free vision screening and glasses free of charge to students who need them in their schools. This was not the only solution to improving educational outcomes or to improving health in our city. But getting glasses, I mean, I don't think I need another study to tell me that if kids can't see, they can't read, and they might be put further back in school. I mean, that's an example of something that's really small that can actually make a bigger difference down the line. The second thing is look for low hanging fruit. Again, many of the problems we face are really big and may require these long changes. But is there something that you can do right now that's relatively low hanging fruit? In Baltimore, when I was the commissioner, I issued a blanket prescription for naloxone or Narcan, the opioid antidote, to every one of our 620,000 residents in our city. I understand that addiction requires treatment, that recovery is possible, that we have to focus on getting treatment to individuals too. But if you are dying from an overdose today, there's no chance for a better tomorrow. And so getting Narcan, naloxone out to people was an example of this kind of low hanging fruit that then enabled us to focus on broader systemic issues. And then the third is related, which is that I would encourage us to think about both the long term solutions as well as short term fixes. Again, in our city, we know that the top killers all relate to cardiovascular disease, strokes, heart attacks, etc. But it's not going to do much good if we just tell our residents, well, that's our focus, is this really long term change. We also have to show them what is it that we can do in the short term. And so short term, we worked on food access, on partnering, for example, with a local grocer to have food that's delivered directly to senior buildings and libraries to where people are. We also worked with our corner stores to help them become healthier. And again, I give you these examples not because these are the only things that work from your vantage point. There may be other types of solutions, but I think starting somewhere, focusing on the low hanging fruit, identifying the short term as well as the long term fixes, those are the general strategies and principles that I would recommend going forward.
I think your point's so well taken, right? They don't have to always be big changes. Small changes and small steps can be big steps in the broader scheme of things. So, Dr. Wen, I mean, you're incredibly articulate. So, without asking you to freak people out, as you take a step back, what do the next 3 to 5 years look like? I mean, we've got some very, very fundamental challenges, and again, I feel like the last couple of years have completely exposed us as it pertains to these challenges. But you look at the next 3 to 5 years, if we don't fundamentally alter the way in which healthcare services are delivered, if we don't fundamentally address health equity, population health management, if we don't fundamentally do something different, again, to your point, not doesn't have to be big changes, if we don't take concrete steps in the right direction, what do you think the next 3 to 5 years look like for us as a country?
Well, I think we are already seeing that kind of worst case scenario playing out because we have already seen what that looks like in COVID. That
Yeah.
the people who are hurt most, who are the most vulnerable, are the ones who are disproportionately impacted when a crisis hits. And these are the individuals who don't have the privilege of physical distancing. These are the individuals who already bore the brunt of chronic diseases, and that then made them more vulnerable for severe outcomes. We've also seen during time of COVID, but also before, how much cost of healthcare is escalating while access and quality are decreasing. And so I think that is the trend that we're in. I mean, the and when you compare what's happening in the US to other countries, we know that we can do better because our compatriots in other parts of the world are able to do better. And so I think the silver lining here is that yes, COVID unveiled many of these problems, but I think there's also attention to them like never before. And my hope moving forward is that we're going to focus on these longer term changes, that there is a way for us to reduce costs. There is a way for us to improve quality and ensure access, improve health for everyone, while also ensuring attention to the most vulnerable. Look, I think this pandemic and this last period has been extremely challenging. And there are a lot of negative things that have come out of it, including the rates of overdoses are skyrocketing, alcohol use is increasing. I'm concerned about childhood obesity, other things that were already problems but are worsened because of COVID. But I also think that there are ways for us to look at this as an opportunity to rebuild a better system and to really refocus our attention, as it should have been all along, on improving public health, ensuring emotional as well as physical well being, and ultimately reducing disparities and achieving health equity.
Dr. Wen, healthcare conversation with the CEO of a PBM. So I'm going to mental health might not be the most obvious place to take the next question, but I wanted to really leave our conversation today with a question for you as we think about mental health, right? I mean, mental health. I mean, arguably the word for the last couple of years would probably be a tsunami, right? That we're probably going to feel for decades together. What do you think employers could be doing differently? Again, you've got a very captive audience here. Um, what could employers be doing differently as it pertains to the mental health of their employees and, quite frankly, the communities where they live and work?
First of all, I really want to commend you for asking this question because it is long overdue for us to put our attention to mental health. I'd say three things. First is recognize that mental health is just as important as physical health. I would like for us to get to the point that if somebody says they were just diagnosed with depression, we give them the same kind of time off, attention as if they said they just got diagnosed with diabetes. Because these are all issues that need to be addressed. These are all issues that treatment exists, and we have to provide people with the treatment that they need. And so I would say, even recognizing mental health and putting it into the same bucket as we do physical health is a very important place to start. The second thing then is to offer similar types of coverage to treat mental health and behavioral health writ large, which includes addiction issues as well. Put that into the same bucket as we would physical health. And so really providing parity, looking at the insurance plans that you offer, and they cover mental health? Do they cover therapists? Are there therapists even in your area where employees are who are available, who are able to see patients with your type of insurance? Looking at that is important because you don't want to just diagnose somebody with an issue and then leave them out there with no treatment. And then the third thing here is that I hope we'll also really focus on addiction, recognizing that behavioral health writ large includes mental health as well as addiction. And we're not just talking about somebody with necessarily a substance use disorder, but also many people with at-risk drinking or who are taking prescription drugs in order to treat an underlying mental health issue. And so pay attention to those broader behavioral health issues, I think, will really help your employee base, because these are not problems that occur to other people. These are problems that occur to our colleagues, our friends, and our loved ones.
Dr. Wen, that was fantastic. Dr. Wen, we've got here at EmpiRx, we've got a program that we rolled out about 3 years ago, and it was pre-COVID. It's under a broader umbrella of complex care management, and even pre-COVID, two criteria that we used to identify candidates for complex care management, where we put in a clinical concierge. One was a person on antidepressants, and another was a person who, from a Johns Hopkins ACG standpoint, who had the markers for opioid abuse. And we put both of those in so that we could literally have a member care advocate hand holding them through their care continuum, so that they did not feel they were on an island and out there by themselves. And so no, your points are amazing. I've really enjoyed this conversation. Uh, the one thing I just want to leave our audience with, when Dr. Wen talked about wide population health, the metrics that we see across the industry can continue to be staggering, right? We're talking about the fact that we continue to look at episodic care and episodic everything in tandem with a very volume-oriented system. 25% of all healthcare in this country, according to economists, is waste. 40% of American adults have comorbidities, and there's 22.4% of American adults between the ages of 40 and 69 are on five or more drugs. So we cannot at this point in time afford to keep looking at things myopically on a singular condition oriented basis. Health equity, population health has never been more important to us than right now. Dr. Wen, thank you. You're amazing, and I really appreciated our conversation today.
Thank you. I enjoyed our conversation too. Keep up your great work and your tremendous leadership.
Thank you. Appreciate it.
Behind every diagnosis and prescription is a human being. EmpiRx Health's personalized care model improves quality of life and delivers savings. Jonathan is a 9-year-old boy with Crohn's disease. Under his previous PBM, he received weekly Humira injections. Upon transition to EmpiRx Health, our population health engine flagged this patient's case due to the unusually high dosage and frequency for Jonathan's age. Our clinical pharmacist contacted the prescriber and requested lab tests. It turned out Humira was not working despite the weekly regimen. Our pharmacist recommended that the doctor switch to Remicade, an infusion medicine covered by our pharmacy benefit. After 3 starter doses, Jonathan would need maintenance doses only once every 8 weeks. Jonathan's parents agreed with his doctor and put him on the new therapy. A few months later, lab tests confirmed that Jonathan was responding really well to the new treatment. His parents were so grateful for his improved quality of life, and so was Jonathan. Finding the right drug for Jonathan not only made his life better, it saved more than $102,000 in annual costs. EmpiRx Health is healthcare done right. Right now, employers pay more than ever for healthcare, yet over 25% of their spend is waste. The time for innovation in pharmacy benefits is now, and great innovation can be so simple. Rethinking complex issues from another angle that is simple, intuitive, effective, and efficient. So how can we look at PBM innovation from another angle? Think of a trip to the grocery store. 2 people with identical shopping lists enter a store and pick up their basket. One shopper fills their basket with items because they are on sale, cheaper in bulk, or offer coupons, but are also not needed and result in waste. The smarter shopper prioritizes value over cost, picking the items they need for the best price to find an optimized mix of items in their basket. In addition to preventing waste, the smart shopper also saves on their total spend. That's one way EmpiRx Health is innovating pharmacy benefits, through value. Conventional PBMs let drug pricing and rebates determine what ends up in their patients' baskets, even if that means pushing drugs the patients may not need. Optimizing drug mix by asking the right questions leads to better clinical and financial outcomes. So we should be asking, what's in my RX basket? Because that's innovation.
Next, let's hear from those who are already challenging the status quo and daring to demand innovation in healthcare benefits. They've embraced innovation, they're aggressively pursuing and pushing the health equity conversation, and they're demanding a move from volume to value in pharmacy benefits. To do so, I'd like to hand it over to our panel moderator. She's an amazing speaker, a TV commentator, and one of the 100 most influential people in the global event industry. Here's Laura Schwartz.
Thank you, Karthik. I'm so thrilled to be here today and to hear from each of the outstanding professionals on our panel. Now, we have 3 fantastic thought leaders, each with a unique perspective as to why the future is now in healthcare benefits innovation. First, I'd like to welcome Jessica Brooks. Jessica is the president and CEO of the Pittsburgh Business Group on Health. There, she leads the effort to redefine and advance the discussion around healthcare value, access, and quality on behalf of all employers. Now, under her leadership, the Pittsburgh Business Group on Health has delivered more than $25 million in annual savings to employers, as well as intervention programs, which have saved employees more than $6 million in copays and out-of-pocket expenses just since its launch. Now, Jessica was also recently named one of the 100 most influential people in Pittsburgh. We also have Feby Abraham with us today. Feby is the Executive Vice President and Chief Strategy Officer at Memorial Hermann Health System, one of the largest health systems in the country. There, he is leading strategy and strategic planning for the system and drives its strategic investments and corporate development. Feby previously served as a partner at McKinsey & Company, where he advised private equity funds across sectors, including healthcare, for over a decade. He has also worked closely with healthcare companies across the value chain, including biopharma, medical products, and health systems, and services. And last, but certainly not least, we also have EmpiRx Health customer, Diana Underwood, joining us today. Diane is the Director of Benefits and Wellness at Town Square Media, Inc., where she oversees the company's robust offering of employee benefits for a total population of over 2,200. Now, knowing that healthy people make healthy teams, Diana is passionate about employee wellness and enjoys her role promoting health in the workplace, from spearheading and serving as the corporate executive sponsor of Town Square's mental health advocacy employee resource group, conducting smoking cessation and weight loss challenges, to the development of an employee wellness webinar series. I welcome you all and thank you for being here. Let's hear it for our panel. Now, I'd love to begin with you, Jessica. Jessica, health equity is sometimes an abstract concept for employers. Could you please frame why it's so important to employers, more directly?
I'd love to. Health equity is one that PBGH is extremely passionate about and has centered more intentionally over the last few years. But it's a strategic imperative in its simplest form. It's a strategic imperative for the business. Oftentimes, employers talk about equity. Now they're hiring diversity, equity, and inclusion officers and serving their customers and employees in a more intentional way. Health equity has to be part of that equation. And that's what we're advocating for. I think a part of it is, how do you define health equity? Where one's race, ethnicity, gender, language, sometimes religion, or other demographics, things we can't control, does not determine our health status or how we fare, how we are able to progress and be treated when we do access the healthcare system. If you just think about the four of us on this panel, whether it's, you work for a company or it's your own company, we rely on the companies we work for quality of life. Our salaries, our ability to send our kids to school or to college, to go on vacations, to buy a certain automobile. Healthcare benefits is a part of that quality of life offering that we're in. Health equity, when it relates to employers, that is centering our health care benefit strategy along with our DEI strategy, our ability to create a quality of life, to ultimately attract, retain, and provide a productive workforce for organizations. Health equity is at the true center of that, and is the action that we've been missing for a long time.
That's so important, Jessica. And Diana, let's face it, changing to a different way of thinking and doing can be paralyzing sometimes. And as an employer, you have chosen innovation in your pharmacy benefits over the same old way of thinking. So on that note, what message, Diana, would you have for other employers and plan sponsors about that need for change?
Thank you. I think that it's time for a fundamentally new strategy. At its core is maximizing value, that is, achieving the best outcomes in the most cost-effective way while still maintaining quality. So important. Our company, Town Square Media, has found that having stepped outside the box in our pharmacy benefits has really resulted in consistently lower cost, higher employee satisfaction, and a better informed population of employee healthcare consumers. However, even though it's a given that healthcare costs are going to continue to rise, there's still a good deal of momentum behind the status quo, unfortunately. So that is something that I feel like needs to change. But we all refuse to compromise here at Town Square when considering any organizational change, specifically a change in the way employee healthcare benefits are purchased and serviced. My recommendation is that change be put as a pivotal part of the employer's strategy. While it can make us uncomfortable as we step out of what we normally do, we know all too well that it's so easy to stay accustomed to habit. That change in our world is, it's consistently evolving. We have to make sure that we stay relevant, retaining a competitive edge. and maintaining the ability to face new challenges. That's all about stepping outside the box. It's just imperative that we are always growing and adapting as employers, and we're also growing our employees right along with us.
Thank you, Diana. And you're right. It's time to step outside of the box. And Fabi, that brings me to you. Within healthcare systems, and you are being challenged with value-based care and moving away from volume. So, Fabi, why is value better than volume in healthcare?
Well, that's a great question, Laura. Let me just set up some context to set the grounds for the discussion on this value versus volume debate. First off, let's celebrate some of the good things about the US healthcare system, right? On the strength side, we drive the world's best innovation and research engine that has led to several new therapies that have resulted in increasing life expectancy and treatment for several complex diseases, widest adoption of preventative screening. This has become the basis for innovation and better outcomes throughout the world. That said, uh, pertinent to the debate, the US healthcare system sees three fundamental challenges, which my fellow panelists have outlined. One is the costs are unsustainable. We spend about 4 trillion on healthcare that represents 20% of the GDP. On its own, it's the fourth largest GDP, i.e., US healthcare spend, and it's unsustainable. Second is we have the worst outcomes among the top 11 industrialized nations, as done by studies done by several think tanks, and they will track some of the very relevant metrics around infant mortality, maternal mortality, life expectancy, avoidable mortality, etc., as they track their outcomes. And then the third is the access and equity remain a challenge. Healthcare access, as you know, is weak for poorer segments of the population, and particularly for across several racial groups and disadvantaged economic segments. So if you then zoom out and you say, look, what is the audacious goal for the US healthcare system? It's to solve all those three things, to make healthcare more affordable, to drive better outcomes while improving equity and access across all groups. Sounds very simple, right? But it's actually much more complicated than that. What is the fundamental complication? The fundamental complication is all of our financial arrangements and incentives have historically been tied to activity rather than outcomes, such as number of doctor visits, number of hospital admissions. But borrowing the quote that people are not really buying a quarter-inch drill, they're buying a quarter-inch hole. What we are trying to do, value versus volume, comes to that fundamental equation. How do you drive better outcomes? And what we as health systems are doing is, is fundamentally looking into that through four lenses. First, by focusing financial incentives and payments to drive better outcomes, such as reducing readmission rates, post discharge ED bounce backs, reducing care variability, etc. Second, significantly driving down the total cost of care by going through appropriate alternate sites of care, such as care at home, outside the four walls of the hospital, that is, care at home, digital and virtual care, etc. Third is keeping people healthy and managing their disease journey so that they don't consume as much of healthcare and we're avoiding all the complexities that healthcare. So you're managing health versus accessing healthcare. And fourth is creating equity in health through population health and leveraging social determinants of health to actually drive down disease burden for several segments.
You know, that's fascinating, and really staying with you for a moment, Fabi. As a leading health system and employer in the Houston market, how do you think of innovation in health insurance, and more specifically, pharmacy benefits should play out?
Well, that's two questions on pharmacy benefits and health insurance. Let me maybe start with the pharmacy benefit
Mhm.
side, and many of the same principles then apply also to health insurance holistically. So overall, prescription drug spend or medicine spend represents about 10% of healthcare. So if you spend 4 trillion in healthcare, you're spending 400 billion in healthcare. That spend is growing at greater than inflation, as we all know, and it's being driven up for a number of factors. Populations are getting older and sicker. The mix is shifting towards more complex specialty medicines. And third, the unit costs are increasing as you hear all the talk about inflation going on currently, but particularly exacerbated by COVID, but that secular growth has been continuing for years. So this matters to employers specifically because the overall healthcare spending and pharmacy spending inflation far exceeds the revenue growth for many of these companies. So as a result, what have they done? Historically, the majority of focus has been on medical spending with a limited push towards pharmacy. And when they've looked at pharmacy, it's been thinking about designing that better formulary, which is really a medicine basket that optimize for rebates and the right mix of the branded versus generic drugs. So the whole rebate driven approach has been in my view, a challenge for innovation. It has been a very myopic focus, and you could start to look at rebate dollars in many different ways, rebate walls, rebate guarantees. That's been the talk of innovation. They actually don't drive a lot of fundamental new thinking and driving down the total cost of care. So as we look to modernize the future of pharmacy benefits, employers should be looking to innovation with a lens of effective whole health for its members. And I would suggest 5 bold ideas for our audience here today. Idea number one is really hampered to focus on real world effectiveness of medicines in driving better outcomes and reducing overall healthcare expenditure through evidence based medicine. So, tapping into the data on in market drug therapies, their differentiation, effectiveness, and cost benefit analysis to guide what medicines are supposed to be in the market and how they're reimbursed. Second, is empowering the patient to be at the center of their own health and manage their own overall health and health expenditure through better patient engagement to drive prescription choices and drive medication adherence. Adherence on medicines, as you all know, is very poor among our populations. We need to provide them with tools, with better information, and drive behavioral modifications. Third, precision medicine, right drug, right patient, right drug, right dose. Leveraging detailed information on their demographics, their genomic information to see what drugs are most effective for specific patient populations. Fourth is population health on a disease level and reducing racial inequities, driving down, per my earlier comment, how do you sort of fundamentally reduce hypertensive costs, diabetes caused by the right medicines, and looking at it from a population health perspective. And finally, technology, data, and analytics will serve as a backbone to enable all of the above and accelerate the journey to fundamentally transform pharmacy innovation.
Thank you so much, Febi. And Jessica, as it comes to benefits, what does an equitable health benefits ecosystem look like to you? And why should employers care?
Great question. Well, one quote that I keep at the center for me in this work is by Martin Luther King Jr. I think this was from a speech from 1966. And it's part of that quote is, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. And employers play a big part in that. I hear all the time, I'm in banking, or I'm in steel, or aluminum, or manufacturing, retail. And but the reality is we're in healthcare too. We don't want to be as employers, but we are in healthcare too. We need a level of competency. We spend a lot of money on healthcare. My coalition right now collectively spends over $5 billion on healthcare annually. So that's just my little part of the marketplace in Western Pennsylvania of about 100 employers. And so that's a lot of money. We're in the business of healthcare. And as long as we have people and not robots working for us, we're going to be in the business of healthcare. So one, centering employers in this solution to actually achieve health equity and making that a goal in partnership with public health systems insurers, and other vendors and partners, PBMs, those who support employers. I think the new wave, or this next generation of solving for this issue of inequity that has existed in this country for a long time, actually was the healthcare system was created from an inequity approach. So that means we have a long way to go, and employers haven't been at the center of it. They haven't been in the front or the back, really. And then many employers, this is the first time that these last couple of years that they're talking about health equity in a meaningful way, and health disparities is a part of a regular conversation. So moving forward, I think first and foremost, employers have to be in that health, centered in that ecosystem. Characteristics, I believe, of an equitable benefits ecosystem includes intentionality, so being intentional, accountable, employee informed. The qualitative data and stories are just as important as the quantitative component. So both having a qualitative and quantitative approach, integrated and not a program. So we can't approach health equity as a program. This has to be an integrated strategy to our entire DEI strategy and healthcare strategy. Aspirational. I think we have to always assume that we're never going to reach utopia, but we're always striving to. Strategic in nature, visible at the highest levels, and that includes the boards of our organizations, and collaborative as well in nature with our vendors, all of our partners, our employees, public health professionals, and other partners in the marketplace. Employers need to understand that they've played a role in inequities, and part of that is our plan design, part of that is in how we contract, and I say make a pledge to do no more harm, and assume that we've contributed to the biases and disparities that exist versus assuming that we are, our hands have been clean this entire time. So there's a level of accountability there. And that ownership is going to go a long way, because that means we're always going to iterate and continue to check and balance and make sure that from plan design to policy to philosophy to how we contract continues to evolve to be more equitable in nature. And also, I believe in centering race in the equity agenda and strategy. That bypassing race is going to be detrimental for generations, and we can't ignore that any longer. We can't rank it lower. That racial inequities is one that we can see is visible, and that we need to make sure that we center that in our overall health equity strategy. And I think this is a big opportunity for healthcare benefits leaders to be at the strategic table. When after the murder of George Floyd and the pandemic and that whole collision in summer 2020 of social unrest and this global pandemic, we had CEOs globally across the world, leading global companies, make commitments to anti-discrimination, anti-racism, to equity, to inclusion, and making multi-billion-dollar commitments to some industries, million-dollar commitments. And this is at the highest level of visibility, ESG goals for boards of directors and CEOs to the DEI strategy. And I think health equity has a very, very critical role in that world, and it's a strategic opportunities and to elevate benefits leaders in our organizations. Vendors are a big part of the ecosystem. Our vendor management, every single vendor needs to be at the table with their approach to health equity. One, how are they defining it? Is that aligned with your definition? And then how should we be working together moving forward? And that includes health plans providers. Even if you're not direct contracting with health systems, you should be having conversations with them around how they're addressing health equity, where is it on their priority list, and how are they articulating that? And then what is their checkpoint going to be back to the marketplace to be accountable to that? And data is a big part of that. The integration of claims data and EEO data, I think, is a major opportunity for employers to have insights and visibility that they haven't seen yet. And ultimately, bad care, bad outcomes cost a lot of money. It's a financial opportunity for employers if we want to start there. And I think it's a fiduciary risk at some point if we don't really take this work of quality overall seriously, outcomes seriously, and centering equity to ensure that we're not leaving anyone else behind.
So, coming back to our employer on the panel, Diana, has health equity factored into your thinking around healthcare benefits? And if so, how are you addressing it? And if not, what would make you look at it closer as it pertains to your employee base?
So, Laura, I'm going to say yes. While we are obviously continuously asking ourselves what we can do to help our employees access the healthcare and the benefits that they need, our ultimate goal is to increase opportunities for everyone to live their healthiest life possible, a full-time, part-time, or whole employee base. We also know that much remains to be done to close those gaps. Simply stated, it's basically a work in progress that will always be a work in progress. But addressing health equity at Town Square Media includes helping our employees understand how to maximize the benefits they have and how to be the best healthcare consumers they can possibly be. We did grasp the concept very early on that changing to a value-based prescription benefit plan can support greater employee access to care and services through a team-based approach. Very important to us. It can not only potentially lower the prescription drug spending that Town Square acquires, but could also lead to better employee health outcomes. Once again, our goal. We also offer, of course, health and wellness initiatives that are open to all employees of our company, featuring monthly webinars hosted by credentialed health and nutrition professionals. And last year, we formed, of course, the Mental Health Advocacy Employee Resource Group. At Town Square Media, we have conducted a smoking cessation and a weight loss challenge and offer an EAP program, which I think has figured in very important to driving equity in our company. That benefit is open to full and part-time employees and all members of their immediate household. So very important, especially during the pandemic. We definitely depended on that quite a bit to help our employees get the support they needed.
Well, Diana, your support of your employees and their families through programming and education is certainly inspiring. Thank you. And Febby, as we come out of this pandemic, what changes are you hoping to see in how value is delivered in every healthcare setting across the continuum?
Well, first off, Laura, as we come out of the pandemic, I think we have to all ensure that the healthcare needs that our population have put off, such as on preventive diagnoses, are brought back safely on, so we don't impact long-term health. But I think several of the learnings that we've had from the pandemic can really serve as a catalyst, a transformative accelerant in how value is delivered across the continuum. As you know, a lot of our healthcare caregivers did a gargantuan service as part of the pandemic, whether it's nurses or physicians or care providers in general, working so hard through the pandemic. And that's led to a significant burnout. One of the fundamental challenges we are going to see as you think about value-based care across the continuum is how that workforce shortage is going to impact total cost of care, at least over the next few years. And so how do we use this fundamentally to both increase our attraction and retention across the care continuum, to provide the health services that our community need? But more fundamentally, how do we use this as the time to rethink and reimagine productivity? Healthcare as an industry where productivity has not grown really over the last 50 years. How can we sort of rethink and reimagine that through the use of technology? So greater adoption of virtual visits and significant capital backing disruptive companies from private equity and public markets have shown real potential in several use cases. For example, how consumers engage with providers and health systems more virtual, more remote, how data analytics is used to better predictive and deliver predictive and precision clinical engagement, how it is used to streamline back office workflows and create efficiencies. How do you deliver population health and therefore fundamentally provide even more value to the population? All of this can reduce, I would imagine, even a quarter of overall healthcare spend because the waste that sits in the system. And then finally, we should all across the continuum start to pretend that we can work in silos and solve the fundamental healthcare challenge. We need to come together and develop more strategic partnerships, coalitions, alliances, joint ventures, what have you, to solve all the problems. So whether it is selecting partners that are backed by private and venture capital firms, or it is backing employers, or working closely with our school districts, working closely with states and government agencies. I think we all have an opportunity to sort of think about where is it that we are natural owners in the capabilities, and where is it that we work with others to deliver better opportunities. So those would be some of the themes I'd leave you with.
Thank you. And now, Diana, you have a very interesting employer perspective to all of this. I'd really like to ask you, how has the Great Resignation really changed your way of thinking around healthcare benefits?
Well, Laura, I think first and foremost, We definitely realized that now more than ever, it's essential that we reassess our employee benefits package, more specifically our healthcare benefits, making use of all of our available communication channels, email, videos, presentations, webinars, employee newsletters, for benefit education year round, not just during annual open enrollment. We're working toward maximizing our prescription drug programs, value results, as well as all the other elements that make up our employee benefits package. For example, helping our employees understand the factors that are driving up prescription costs. A lot of times they don't know what that backside is. Letting them know that skyrocketing cost increases aren't sustainable and they cut into other benefits. So explaining to them what a value-based formulary is and promoting the fact that value-based formularies give access to life-saving and quality of life treatments at affordable cost. That's just one of the facets of our stepped up healthcare benefits engagement initiative. I think it's so important that employees once again be educated. Also, we work to ensure that our employees and covered family members are aware of available support services that can provide education about managing certain health conditions, especially for a difficult diagnosis. Also, mental health focused benefits like those that are offered through telemedicine platforms. They're also among some of the best offerings that can contribute to a company's attractiveness in the job market. I just think it's worth the time that employers take to really look at their healthcare benefits package and all of the other employee related benefits that they're offering and all of their communication pieces, their employee facing documents. Obviously, investing in well-deserved benefits, I feel like is the best way to ensure that a company and its employees come out on the top of this ongoing struggle for talent. And of course, keeping the wonderfully talented people that we already have.
Well, Diana, those are, again, incredible programs and just terrific to support to all of those employees throughout your organization. Now, if I could ask all of you just one more question. Employers are picking up 80% of the healthcare tabs today for health insurance. Why now? Why this rally cry now? Jessica?
Yes, that's a stat that I mention very often when I talk about why it's necessary for employees to be at the forefront of the many issues that we covered today on today's panel. There is a sense of urgency because lives are at stake. And I tell employers all the time that as whether you're in retail or in some other industry, you are in life or death business. You're in the pain or joy business because you're working with humans. And the humans that you serve through your healthcare benefits are not just those who have access to badge into your door, but they're their families. And you don't know who your employees love. And who they love are probably much more diverse than what your population, your workforce looks like. And we're leaving them behind by employers not taking a lead role in this. So I don't think we just have a seat at the table on these key issues. I think employers need to be leading these key issues. And if we don't step up now, I think we're going to lose a whole generation as a result of it. I think a lot is at stake if we don't step up collectively as a business community.
And Febby, what about you? Why is this important right now?
Employers cannot kick the can anymore. There is an imperative for them to act now. There are a few different reasons for that, Laura, and I build on Jessica's comments as well. But first of all, there is a war for talent going on. So as you think about your HR function in any company, any employer, they want to sort of hire the best and brightest. It's hard. There is real supply shortage of people. People have many choices. The pandemic has only accelerated those choices. And to really create a differentiated value prop, employers need to make health and wellness a core part of their offering, and innovations that can reduce overall health and wellness challenges for the employee base are going to be critical innovators to the point that they represent 80% of overall commercial health spend. The second factor is from a CFO perspective, from a finance perspective, it's a big chunk of the overall cost equation. And as a result, all innovations can be accretive to the cost. Many companies are faced with rampant inflation challenges, and they have to sort of think about one of the big drivers of overall expense, which comes in health and medical spend, and how do they sort of manage that through more healthy living. The third factor is the societal factor. There is an imperative going on from an inequity perspective, from a mental health perspective, that employers, just given the amount of workforce they have, they're saying, look, wait a minute, we have an opportunity to sort of make it our mission to sort of transform this, and this is not an option for us to sort of forego anymore. We should be at the forefront of it. I think that sort of sets the stage for them to sort of drive some of the innovations. And then the fourth reason I'd say is they've realized that they are a big factor. They can make the change. There is a supply side equation also that's heating up with all the choices that are transforming value-based care we talked about. And if they can sort of be at the forefront of that innovation, they can fundamentally transform, just given their buying power, their collective influencing power on the entire health system and healthcare narrative.
And Diana, from the employer perspective, again, why is this innovation, this transformation so important to act on right now?
So Jessica stated it very eloquently. I think life and death business, sometimes we don't look at it like that or don't think that's what it is, but in a lot of ways, we really do hold the health of the employees and their family members in our hands by the health options we offer. Also, I don't know of any other expenditure that an employer would commit to that doesn't have transparency, that they know what they're spending their money on. I know that with fees and things are sometimes buried. It's just so important that employers demand transparency, and it really is great to be able to understand what the cost drivers are and where that expenditure is going, and what it is doing to help employees get back to better health and take care of their families. Just so important.
And with that, we're out of time. But this conversation today is truly what innovation in healthcare benefits sounds like. So Jessica Brooks, Febby Abraham, Diana Underwood, thank you all for being here. And to our audience, we hope our panelists have inspired you to ask more and want more for your employees. I'm Laura Schwartz. Thank you for joining us today.
I'm Troy Remy, the Vice President of Human Resources for Canal Barge Company, located in New Orleans, Louisiana, with 1,800 covered lives in our medical plans.
I oversee medical and prescription benefits for 18 public school districts serving over 12,000 members.
I am the Secretary Treasurer of the International Brotherhood of Trade Unions, Local 713. We have in excess of 20,000 members.
Our pharmacy benefits were increasing at an exponential rate. So that's where EmpiRx came in.
We're constantly looking for ways to save money without sacrificing service or quality in our delivery of healthcare for our members.
When we interviewed EmpiRx, their customer service component, their reporting capabilities really stood out. The thing that made the biggest difference for us was their partnership, where they would work with a doctor to find the best prescription.
Pharmacists at EmpiRx actually spend their days studying all of the new medications, and they're actually advising physicians on patients' behalf what is the best thing to be taken. And the physicians are open to it because, quite frankly, they're overwhelmed with patients and they're overwhelmed with this drug market that continues to add thousands of new drugs every year.
There are so many generics now available that are so much lower in cost and equally effective, but people are reluctant to change because it's their health. But if your PBM, like EmpiRx, talks to your doctor and says, EmpiRx is recommending that you take this medication because it's FDA approved and it has a lower cost and potentially a better outcome, that makes it much easier for the member to make the switch, and it makes the doctor better able to prescribe going forward in the future. So you're accomplishing two goals at the same time, caring about the person, not just the employee. And I think that's how EmpiRx makes a difference.
My past pharmacy provider actually was in the business of encouraging pharmacy spend. That was where they made their money. EmpiRx flipped that around. You're going to deal with us directly, and we're going to make sure that we work with this as a partnership to save us and you money together. And they've clearly delivered on that value. We've been using EmpiRx Health approximately 4 years. In my pharmacy spend, it's half right now of what it was 4 years ago. It's amazing.
Employers can't afford to provide medical coverage if it's too costly. And rather than have our members do without, we have to create plans that provide value. And EmpiRx helps us do that by keeping the cost of our medications down.
A lot of times people are lured in by higher rebates when at the end of the day, if you're getting a big rebate check, it means you're spending too much money to begin with.
Because of their clinically driven approach, EmpiRx sets themselves way above other PBMs that we've used in the past.
The way they're approaching this industry is innovative and it's ahead of their time. It's where we needed to go a long time ago, but I'm really happy that EmpiRx is there and that we're partnering with them.
I will always recommend EmpiRx. They actually deliver on the things they say they're going to deliver. And what more could you ask for?
I'd like to extend a huge thank you to our panelists today. What an incredible group of leaders, right? We've worked with Diana now and her team for over 4 years, and it has been an absolute privilege to partner with someone who's always thinking one step ahead. You heard her passionately talk about embracing innovation and rejecting the status quo, and that's exactly what Town Square Media did when they chose EmpiRx 4 years ago. Jessica is one of the smartest people I've had the pleasure of interacting with. Fiercely passionate and incredibly smart, especially as it pertains to racial equity. She is on the speaker circuit and just absolutely on fire at this point in time. And it's very difficult to leave a conversation with Feby and not come away totally amazed by his breadth of knowledge. The chief strategy officer and the McKinsey consultant comes through cleanly, right? Number 1, 2, 3, 4. He's a multi-point, 360-degree kind of guy, and that's with everything he discusses. So I'm going to pull a Feby on you, right? Here are the key points I'm hoping you've taken away from today's event. First, health inequities exist in every single population. This isn't something that impacts someone else. When we continue to embrace condition-oriented clinical programs, we are zeroing in on the most dominant condition and creating care inequities, right? Number 2, population health management and whole person health are incredibly important and something that you should absolutely expect from your PBM or your health plan. Condition-oriented disease management, you heard me throughout those statistics up front. Condition-oriented disease management has done very little to move the needle and has neither improved clinical nor financial outcomes. Number 3, innovation in healthcare benefits is possible without being disruptive. There is innovation in simplicity. There is innovation in intuitive solutions that address the root cause versus the symptoms. So if I'm you, reject Band-Aid solutions. Embrace ones that get to the guts of your healthcare benefit needs. 4, healthcare benefits should be about care, right? How can we get obsessive about conversations that are all about pricing and pricing models and completely exclude care in a healthcare benefits conversation? Number 5, the problem with your pharmacy benefit spend is the mix of your drugs in your population's drug basket. Again, the obsession with drug pricing and drug pricing models is nothing more than a fixation on symptoms. When you or I blow through our household budget in any given month, the first thought that comes to mind, or the first question that comes to mind, is really what we bought. It isn't whether we bought something that was more expensive than we needed to pick up. Optimizing your RX basket addresses the root cause of what's driving your pharmacy spend. And this absolutely includes specialty meds as well. Stop thinking the same old way. Embrace change. Drive it. Reject the status quo. Stagnant water breeds insects and disease. Water in motion, like a river, is continually changing and remains fresh and relevant. Stay fresh and relevant. Thank you very much for attending today's event and hope you have a wonderful rest of your day.